We'll take two questions from the floor, and then we'll take a question from the UP Open University. Yes, and then Dr. Go ahead, Dr. Claudio, and then.
Sylvia Estrada Claudio, UP Center for Women's Studies. One of the things I've noticed in the work we've tried to do a lot with policy changes in health, even advocating the reproductive health bill, for example, is at all levels of government, especially in the Congress, there is an inability to listen to policy studies or even to use the expertise of the policy staff. I don't even know how many congressional people actually use the money to hire policy staff. I think they hire their relatives. In any case, I was wondering if the panel or anyone else had any idea about how to have effective mechanisms, even in just the healthcare system, where if there's a policy, a law, a bill at various levels, there can be a mechanism where there can be a review or an input of policy people before that thing comes to pass, because it's two levels. The citizens try to intervene, but it's so very difficult. But perhaps we can suggest mechanisms where there is really a space for policy intervention of people with the expertise at various levels of crafting policies and even laws.
Thank you.
We have limited lobbies, but actually what you're saying, Guy, that we should also be alerted to the policies that are in the process of being crafted. We don't have that. And that is not Department of Health, that may lie in congressional staff, etc. The processes of Congress, that they should alert people whenever there are key policies that are being deliberated in Congress. And then, as citizens, we have to make sure to be there during the deliberations.
During the hearings.
Yes.
Okay.
I'll add a little further, but this side of the professional organization, over drinks one afternoon with Secretary Romualdez, we came to some conclusion that the health professional organization will get involved only with congressional hearings insofar as it will be affecting their organization. So it's very lobby, parochial, inward-looking, and it's in a sort of a, how do you call it, vertical parallel silos. In fact, in one occasion, we wanted to deal with the Professional Regulation Commission to do a team approach where you don't deal with doctor training, pharmacy training, nursing, or dental, but we want to cut across doing primary. They have no mechanisms for that. They're looking at silos and only because of parochial interest. I think time has come to change this kind of thinking.
Go ahead. Dr. Paterna.
My concept is from the point of view of people's organization.
Correct.
I think the whole concept of this forum, and as pointed out by Dr. Romualdez, was we need political will, but we also need popular support. And one of the things that we wanted to do with this forum was, one, present it to the presidentiables. Second, build up a mass base that will demand universal health care. That sees that the time for universal health care is now. And I think most of us feel, this is one forum, but this will not be the last forum. And that we will be conducting continuous forums to build up popular support for universal health care.
What you mean is a constituency for universal health care. That has got to be nationwide. You've got to bring this forum from one end of the country to the other. Yeah.
Let me just add one thing about what is being said. For example, if the COMELEC will disenfranchise me, refuse to give me the privilege to vote, I can always go to court and say, you better restore that. That is a basic political right. Why is that not happening in health? Correct. Somebody died without any medical attendance. What is his recourse? Nothing. He just accepts death. But that is a basic political right. Therefore, there must be a movement of people to be able to do this. In relation to Dr. Estrada's comment is, I'm just wondering, during the hearing on the reproductive health bill, do the congressman ever summon ordinary women and say, are you happy with 6 children? Do you want something done so that you will have only 2? Really? I thought only all the experts. But we didn't hear them. We didn't hear a very big voice coming out say, "You congressman, BS to you. Give us something to give us something to regulate our family."
All right. Go ahead.
Sir, to respond to Guy again, it's an apology because the challenge was, is there a health policy study that's fed the government? I have to apologize because it's usually health policy advocacy that we are pushing. Advocacy. And what happens is, rather than information, it's our interests that we are putting forward. I'm sure the chairman, Fernando, feels this. When interests are being the ones fed forward, rather than information being made available. And that's why we're trying to pose a system of, let's say, DOH mounting a council that can provide information that is less biased. Because if that's not done, if information is not managed, it's the interests of individual advocates that tends to take precedence.
Thank you, Dr. Padilla. Yes, please identify yourself.
Good afternoon. Victor Doctor. I'm president of the Philippine Pediatric Society, and I'd like to comment on our specialty and over specialization. We are about 4,000 members already, regulated by 3 boards. That means the integrity of the association is very much well intact. And this is one of the missions and the focus of the specialty is to ensure quality, integrity, and precision of the pediatric services. I speak for pediatrics, and that we should want to make this universally available, especially for the doubting mother. The example here, that the doubting mother doubts she can be treated well, diagnosed well in a government hospital. That's what we regulate. And to ensure this, pediatrics in the general population of physicians, we created the undergraduate pediatric curriculum, which we, together with Dr. Arcadio, recommended to the APMC. And to make this, it's not because that pediatrics is available only for the pediatrician, but we want this to be available for the basic graduate in medicine, so that the mothers, all mothers, will not doubt that the third child will be misdiagnosed and mistreated.
I would just like to reiterate what Dr. Domingo, in answer to that, mentioned earlier. Yes, I think that the specialty of pediatrics is among the better specialists in the sense that it is has a primary health orientation and has been very supportive of new interventions such as oral rehydration and so forth. However, still, I noted in the intervention that still it is doctor oriented. In fact, we're saying that maybe we don't need pediatric skills only to be developed by graduates of medical programs, but rather share pediatric skills with other types of health workers, such as our 100,000 unemployed nurses and our midwives who are also directly involved in the community.
Are there legal impediments to?
Yes, there are probably legal impediments. That's why we are recommending, and maybe Dr. Domingo should answer that.
The legal impediment is very hard to handle because you have a law for each profession. And if you look at the law is meant to protect the profession. It defines what they only can do and no other professionals. But the reality in the field is this. If you are in a place where there is no doctor, you can teach the midwife or the nurses certain diagnostic and interventional procedure that can be done by these people just as well. And that will be filling a need. So our first proposal is to revisit this, unify them so that you have a team concept. That's exactly what I mean. Instead of protecting TARP, complementation, meaning a doctor may voluntarily agree without invoking the law that in this place that is only a population of 1,000 and nobody will stay there. We are authorizing, we are supporting a midwife to do these things for us.
Okay.